Well, it is hard to gauge the full extent of the human cost in Gaza. Among the most reliable testimony comes from medical and aid workers. Dr. Feroze Sidhwa is one of those. He's a trauma and general surgeon who worked at a hospital in Khan Yunis in the southern part of Gaza earlier this year. And he joins us now. Feroze, very good to see you. So how would you describe conditions in that hospital in Khan Yunis when you were there 6 months ago?
Yeah, like you said, I was there about 6 months ago, and even then, back then, European Hospital, where I was the best resourced city block in the entire Gaza Strip, and still it was just a total and complete disaster. The hospital itself had 10 to 15,000 people sheltering on its grounds, with using about 4 toilets, all living in tents, no showers, 1 water spigot available to them. There were also people sheltering inside the hospital. So if you're trying to move a gurney through the hospital, you have to dodge little kids playing and women cooking and all sorts of stuff. You can imagine in that circumstance, keeping anything clean, let alone sterile, was impossible. The entire hospital staff lived at the hospital or right outside of it because it was far too dangerous to go home. Khan Yunis was still in the process of being destroyed back then. Yeah. And the hospital itself was almost impossible to work in. It was filled with 1,500 people admitted to it, not just the people sheltering there, but 1,500 admitted patients in a hospital that has 220 beds. So you can imagine it's just completely impossible to care for almost 800 seriously injured children in that situation.
Yeah, so what sort of treatment were you able to offer patients then under those conditions?
Under those conditions, for example, there was a little girl named Juri that we found dying of septic shock from septic wounds. Well, with me and 4 other surgeons spending something like 30 hours over the course of 10 days, we were able to get her healthy enough that she could be evacuated to Egypt, actually. And she's there now. I just got a video message from her the other day. And on the individual level, back then at least, I don't know about now because the supplies are different, but back then it was possible to provide aid at the individual level, but not at the level of the massive societal level that it's needed. Juri was one 9-year-old girl. There's literally tens of thousands of kids like her in Gaza right now. There's absolutely no way to take care of them.
What were the most common injuries that you were treating?
So the most common mechanism of injury was from explosions, either airstrikes or tank shelling or artillery, who knows, or drone strikes, whatever it might have been. Those resulted in very severe limb injuries in patients who could still survive. Now, we also saw a large number of shootings, and especially of children who had been shot in the head. I saw, on average, 1 child shot in the head every day while I was there. And I'm talking about young children, not teenagers. And it's almost impossible for really any hospital to take in that number of children with severe traumatic brain injuries, especially gunshot wounds, which are difficult to treat, and expect that you're going to have any surgical success. And on top of that, your European hospital is not even a trauma center, so the level of injuries that we saw was pretty incredible. The bombs that the United States is giving Israel are incredibly powerful. They're meant to be dropped on reinforced military bunkers in mountains, not tent cities and poorly constructed apartment buildings. So they have the effect that you would expect in that situation.
So you've spoken about physical injuries. What's happening with mental health of those living there and those who are working there and trying to help?
Yeah, so our healthcare colleagues, our Palestinian healthcare colleagues, really are a target of this attack. About 1,000 of them have been killed so far, which is 1 out of every 20. That's 5% of the healthcare workforce in Gaza, and it's really pretty shameful. About 162 doctors are identified, several, many nurses. It's a disaster, and so there's an overwhelming sense that they're targets, that they can be next. There's an overwhelming sense that I might as well be next. What's the point? We're all going to die eventually. Might as well get it over with now. And that's pervasive, unfortunately. People have a limit. A year of undergoing this kind of torment and torture, seeing your own family ripped to shreds while you're working in the emergency room, it's too much for most people to take. But the children in Gaza, especially, are probably the most obvious examples of the just incredible psychiatric distress that's going on. I'll tell you, I regularly saw children, and I mean, again, like, preteen children who were suicidal. And I mean that literally, they wanted to die. That's extremely unusual. I've worked in Ukraine, I've worked in Haiti, I've worked in southern Zimbabwe, I've worked in Burkina Faso. I've never seen that before. That's just shocking. And it speaks again to the level, the extreme level of what is being done to this society.
Very powerful and confronting. Feroze Sidhwa, thank you very much.